welcome to Breastfeeding Buddies. Today we're going to be talking about hand pumps, and we're going to be talking about the Medela Harmony hand pump today. Also, if you're tuned in with us right now, you can make questions or comments through the Facebook Live page. We'll also have a little bit of time at the end if your questions didn't get answered as we were talking about the Harmony pump today. So this is the Harmony pump here. A lot of people get them at the hospital or through their WIC office, and I just wanted to kind of show you how this pump works. So this right here is the bottle, and this also is what collects the milk. You're going to screw on the pump body like this, and then this is the handle, and you'll put the handle in right here. There's a little hole. And then the next thing that you're gonna want to do is, these are called the breast shields, and you're gonna want to determine which one is the best fit for you as you're pumping. And this is a picture that shows how it should look correctly. So when you're picking your breast shield, you'll have your breast, and you will make sure that your nipple is centered in the breast shield, and so you'll want the nipples centered in the tube. You're going to want to make sure that it isn't rubbing. So these are a couple questions to ask to find out if you're using the right breast shield size. Does your nipple rub the sides of the tube to the point of causing pain? Do you see more than 1/8 inch of the areola, which is the round part, the circle? You're going to want to make sure that it's not more than 1/8. If it's being pulled into the tunnel, then it might be too big. And do you see your nipple changing colors during or after pumping? Is your nipple or areola swollen or puffy after pumping? So if you answered yes to any of these questions, you may need a different size breast shield. Contact your local WIC to have the size checked. So most pumps include these two different sizes, and if those don't work, like we were mentioning, you can check with WIC or you can check with Medela. They also have it a lot at supermarkets or Target or Walmart. They have a lot of different things like this. So now that you have your pump together, it's time to start pumping. So the first thing you're going to want to do is put your the pump to your breast. You're going to want to hold on to the shield with your hand, not the bottle, and then you're going to want to start pumping quickly on the short end of the handle with your thumb, like this. And this usually takes about 2 minutes, but you're going to want to keep doing that pretty quickly until you start to notice that milk is starting to drop into the bottle. Then once you notice that the milk is starting to drip, you're going to switch to the handle, and you're going to use this a little bit more slow. It's kind of similar to the baby's rhythm for when it's breastfeeding, and you'll just go a little slower. If you notice that the suction seems kind of hard or a little bit too strong, don't press the handle all the way down. You'll want to just pump a little bit less like that, and that will make it less strong and feel more comfortable for you. And then you'll repeat that on the other side, and you'll want to do that every single time you're pumping. You're going to want to make sure that you do the stimulation mode where you go fast and then you go slow. Also, we want to share a few things to help ensure that your pump is working correctly. And sometimes the handle will stick a little bit, and so you'll want to take it off like this. And when you'll take off this rubber diaphragm, and you'll want to check out the stem, which I just dropped. Here we go. You're going to want to make sure that this is centered. So you don't want it to be sideways, you want it centered like this. So the long part of the oval matches with the little handles. So you'll want to push that in there nice and tight. And now that you have it correctly, you'll put it in the handle. The handle also, the edges go the long ways also. And when you're popping the diaphragm in, you're going to want to make sure that you're popping it in nice and snug, kind of like a Tupperware lid. You know how you go all the way around to make sure that there's no open holes or anything like that. And then you can go ahead and put that back on your pump, and hopefully that will solve your sticky problem. Another thing is we talked about having too strong of suction, but now sometimes it might feel like you are not getting enough suction. So you'll take out the valve and check out this little tiny white piece. This is called a membrane, and this little piece is pretty important. You wouldn't guess it by looking at it, but it's pretty important. You want to make sure there's no tears or rips or anything like that, and you'll want to put it back in and make sure that it's popped in nice and snug, like that. And then put your pump back together, and that will help with the suction. If you are feeling any pain while you're pumping, you'll want to go back and look at the breast shields that we talked about earlier and ask yourself those questions. If it's doing any of those things, you will probably need to get a different sized breast shield. Also, not all women's breasts are perfectly sized, so you might need a different breast shield size for each breast, and that's perfectly fine and normal. But just ask yourself those questions. Also, you could be pumping for too long, so we recommend that you only pump 10 to 15 minutes with the Harmony breast pump manually per side. Thank you for coming to Breastfeeding Buddies today. We'll have it the same time next week. Also, we're going to stay open a little bit longer, so if you have any more questions or comments that we didn't quite get during this session, we're still online. So again, 10 o'clock Tuesday next week. Thanks for coming. Bye.